We're going to get started now. Mayor, please take your seat. You have a... You may have to move the chairs a little bit forward if you in the middle. The city PNC president, please have a seat. Kyle Price. Who else? We have such a friend representative, so we need to have somebody else. You are representing the SEVA Clinic. To welcome each and every one of you for the inauguration of the SEVA Clinic. SEVA in Sanskrit means selfless service. Measure your success only by what truly matters. Your happiness and the happiness you bring to others. If today you felt inspired, supported a friend, stood for a cause, or inched closer to one of your dreams, then today is a resounding success. By coming today and showing your support, you represent SEVA's founding values, being selfless, being present, and being there for one another. Thank you. SEVA Clinic is a Texas not-for-profit entity with a 501c tax-exempt status by the IRS and is a result of 18 months of planning by lots of volunteers who are here. And it has a very ambitious board for itself. And let me first introduce the other board members. Honorable Mayor Tom Reed. I met him 18 months ago in his office and looked for a direction, and he put me in the right footing. Next, I want to recognize the other board members, Jim and Heather Dixon. Jim is an entrepreneur in furniture industry. He is the treasurer of SEVA Clinic. He will collect the checks. And Heather is founder of Christian Helping Hands and in charge of public relations for SEVA Clinic. And besides their monetary support, they both have put an enormous amount of work. Almost on a daily basis, they've been stopping by, buying this and that. And so thank you, Jim and Peter. Jerry Farmer, owner of Gulf States Plumbing. He is the director in the board. And beyond his invaluable monetary support, he, his family, and his crew have been working in the front to put this clinic into order and ADA compliant and all that. So thank you, Jerry. Shrikant Venugopalan, he is the secretary of the SEVA Clinic. He is also our computer guru. Ramesh, you made it. The next is there are three medical directors besides myself. Dr. Subhadra Bandakavi. She has been a tremendous help. She's in charge of physician scheduling. So if you haven't given your name to volunteer, she's the person, so she will fill you in the spot. Put you on the spot. And there's another medical director, Dr. Deepa Iyengar. She's not here today. She had to spend time with her daughter who was just graduating. She's an associate professor at UT Health and McGowan Medical School, and she'll be bringing UT residents to SEVA Clinic. Deepa also has a non-profit entity called Pragati, and some of the members of that group are here, and they are serving in SEVA Clinic. Next is Joanne Barrett. Joanne? She's the Chief Clinical Officer of Kindred Hospital. She has helped me for the health fair at Meenakshi Temple for the last 20 years. and she oversees the nursing scheduling and ancillary support. Last but not the least is Dr. Appan. If anybody wants for any not-for-profit entity, any fundraising, he's the man. So now I would like to welcome and thank Memorial Hermann Hospital System. The hospital system has been very supportive from the very beginning, and with no hesitation, before we had nothing to show for, and they gave a seed grant of $10,000. Thank you for believing in us. And let me recognize the leadership team. Very rarely that 4 of the top people of the hospital Southeast Memorial come to the same event. They take turns. Here we have the CEO, COO, CNO, and the physician liaison. All 4 are here. So Kai Price is the CEO. I've known him for many years, worked with him. Thanks, Kai, for being here.
Thank you.
Mario Garner is the Chief Operating Officer. Kelly Ochava, can you please? She's the Chief Nursing Officer. And Rebecca Lilly, Physician Liaison, and he has been also helping for 20 years in the healthcare at the Meenakshi Temple. Is Ashley Economist here? Yes. She couldn't be. So all these people, they are just running not just Southeast Memorial Hospital. Now we have Pearland Memorial Hospital. They have full positions in both facilities. And thank you. You are part of this very small beginning, and thank you for being here. And then Pearland Chamber of Commerce and Pearland Neighborhood Center. So Pearland Neighborhood Center is where we are. And they were very generous to give us the space in the front. So don't think that the SEVA clinic has all this power. They have generously allowed us to use the entire facility, but we just have the front 2 rooms where it says the SEVA clinic. So we have 1 room to check in and nursing assistant vitals, and then 1 room for the physician to examine. We have just the 2 rooms in the front. We just wanted to start simple. We want to just begin to walk before we run.
So far.
Well, yes.
Dr. Nathan, Councilmember Jerry Moore has arrived, and Missouri County Commissioner Stacey Adams.
Oh, Stacey Adams here.
And also Councilman
And David
Little.
I didn't see. Oh,
Come on
I'm
in,
sorry,
inside.
I didn't see you. Come on, gentlemen.
Mr. Adams, we have actually, can we maybe position?
Jerry Moore and David Little.
They can, please be. I think they can, when one of them speaks, they can mention what you do here. So I had to meet with their board. They asked a lot of questions, and finally they got convinced that we are good people to work with. And so here we have the president, Brad Christian. Linda Darnell, she's the Pearland Chamber of Commerce also in the PNC board, and ambassador to the board member. Right. Becky Cornelius, she's busy writing there. Becky. She's a board member in the PNC, but she has been in the PNC for quite some time. Carol Arts, she's here. Carol. Why don't you come and have a seat?
Oh, I'm good right here.
Carol is the CEO and President of the Pearland Chamber of Commerce. Thank you. Roy Castillo, PNC Board and the Pearland Police Department Sergeant. We are safe today. Anna Bryant, PNC Vice President. Anna. Thank you, Anna. Buck Stevens is here. Stacey Adams, the County Commissioner, Brazoria County Commissioner. And in the PNC board. David Little is City Councilman. Gary Moore is also a council member. City Council. So as you can see, all these officials showing up for this clinic, that's an honor, truly an honor for us, and we are very inspired and motivated to do our job. Thank you. Now I'd like to thank the physicians, and I know this list is being added, and I have the original list. If I miss anybody, please forgive me. Dr. Suma Manjuna, Dr. Rekha Neela, Dr. Datri Kodali, Dr. Siptin Ali, Dr. Vijaya Kailash, she got called in for an emergency. Dr. Ramesh Patel, Dr. Radha Rao, Dr. Arun Mukhapati, Dr. Kayuri Papa, Dr. Chandra, are you here? Chris Chandra. Of course, there are several other physicians who are also here. We hope they will also be signing up to volunteer. No pressure.
And we have our youth volunteer out here.
Thank you.
And I have one more.
There are several medical and nursing and other volunteers. Taylor Barrett. Taylor has been volunteering in the clinic when she was like 5 or 6.
Started her own.
And then Suresh Tipneni has helped with the banners and signs for the SEVA clinic in a short notice. He's not here, his wife is. Jonathan Janardhan, in fact, set up all the microphones and everything. Jonathan, all these outside. And we have Dr. Appa Rao. He came to help. He's in Subhadra's husband, Dr. Appa Rao. He's a psychiatrist, so we're not planning to have psychiatrists here. Dr. Siva Bodagala is here. There are some youth volunteers like Arav and Stephanie Lamb is she here? Stephanie. Shika Lucky. Shika, I said she's coming. So by the way, if there are other youth volunteers or any of you have your youth want to volunteer, we will give community hours. And Kayuri Papat, can you please stand up? And she's the person to sign up. So the physician schedule is kept by Dr. Subhadra. The nursing schedule or ancillary nursing schedule is Joanne Barrett and Kayuri for all the student volunteers. So that's just contact, we'll have emails, or you can send it to me, I'll forward it. So, of course, there are several not-for-profit entity organization members are here, and many of you are from the Meenakshi Temple, and thank you for coming. Last but not the least, I want to thank my wife Nach. She's solidly with me, guiding me in every effort I undertake. I have to get clearance from her first before I sign on anything new. And our children are here, Nitya and Muthu. Did I miss anybody? Hita keeps track of me. Okay, now I'm just finishing up. Just want to give you a quick rundown of what this clinic is about. This is the general medical clinic, so this is not a specialty clinic. So we're just starting out with the general clinic. So we will just manage hypertension, diabetes, cough, cold, common problems. I think that's where the emphasis in healthcare is, because if you can take care of the problems at the root, at the beginning, then they won't be showing up in the emergency room with an expensive bill to the taxpayers. So this is where we want to serve the people who are in need. So if you have an insurance, please don't come here. And not that, I'm not saying in that way, but this is meant for the people who really in need. So we want to, because we have only one day of the week, we are only open on Thursday evenings around 5:30 to 7:30. So we don't want to commit too many days and not able to staff them. So I just want to just make sure what we commit is what we can deliver. So it's just one day, it's a walk-in clinic. We think we can manage about 15 patients in that time period. If necessary, we can have a second 2 physicians or 3 physicians, but the time is only that much. So we will have a nurse or somebody who doesn't have to be a full nurse. They have been trained, a medical assistant. They will be in the front, they will check the vitals, they will check the symptoms, and then the doctor will be in the next room, they will see the patient, and then we move. And we have an electronic medical record, so there's no paper chart. You don't have to do any quality indicators or anything because we are not billing. So, and you don't have to, we are not going to ask for insurance information or anything. There's a $10 donation is optional, it's not required for the clinic. The only reason we have it is just maybe it will, we don't want people who are seeking drugs or something showing up in this clinic because that's not the intent. So we will not be prescribing pain medications for that reason. So we want to discourage that. So because that would become a problem. So this is a doctor sitting there, you can go and get it will be very hard to disprove somebody is not having back pain or anything. So we will not be prescribing pain medications. We will prescribe diabetic medication. We'll be initially only checking for blood sugars, but we are working with the Memorial Hermann to set up a lab pretty soon, but we're just working on the logistics on that. Medication prescriptions will be given, we only will prescribe generic medications which are usually about $4 to $5 in the nearby pharmacies. I don't know whether any of the pharmacy people showed up, I did send an invitation. So that's the format we are, and then we could have some samples, we could, if they're available, if we can lock them, we can give them. But that's pretty much the simple start for this clinic. So it's, don't expect too much out of this, but hopefully this will grow. There are people who say they can check vision, some people say they can do dental, we don't know yet all that, but maybe down the line. Pediatrics, there is of course 2 or 3 physicians here who are very anxious to start it. I'm not sure I have because we need at least 5-6 to have the continuous coverage, but she says she will do it. So I think whenever we have the available, so there will be a pediatrician and an adult physician. But definitely an adult physician, pediatrics physician, whenever they are, we will see the children. So that's pretty much what this clinic is about. And again, thank you for coming. And you all, you have other things to do on the weekend, and you all showed up here, and we appreciate it. We feel encouraged. And we will, if you have any pressing questions, 1 or 2, I can answer. Then we have people to just talk. So, anything you want to ask? Any of the city council people or anybody wants to know something, I can answer.
When is the first day it starts?
June 1st, Thursday. Thursday, June 1st, onwards every Thursday.
How are you getting the word out to people?
They say that it will get out very quickly.
Well, I'm dropping my insurance.
Some of my patients told me, I said, for you or you come to my clinic.
So will it be through the neighborhood center or Christian?
Yeah, I think, Hita said, she has actually sent out some public service announcement,
Sure,
but the chamber can send out to all their members, and then we are going to send a write-up of the opening today in the local papers. So, we will take any recommendations you have for sending the word out. Yes, we want to be used, we want to have every time there, which is, many people want to come in, and the back there is some space, come inside.
Yes,
Shy people, they don't want to come inside. Okay.
Doctor,
Yes.
I suppose you already have a relationship with the school district?
Not directly. Hita is our PR. She knows, but we can send. We leave a contact with Hita or me.
Roy, what is the lady's name that does the? No, not.
Actually,
She's been there for a while, but she takes care of all
but
the
every one of you just
homeless.
pick up a card. This little simple, small card has the information about the address and when it is open. So just there's a lot more. I will get it out. So if you can, I mean, there's some in the front also. So every one of you take one because you may not use it, but if you may know somebody who may need it. I mean, you may have a neighbor who needs it. Just send them, and we are here to serve. Definitely, we all know people who would need this help. And there's no further questions. I just want to now move on to a few things, and then we are going out to the events. A few speeches. So, except the mayor, all the others, limit your speech for. And now I request Honorable Mayor Reed to say a few words. Thank you.
Would you believe that in 1985, I held my last council meeting in this room? Wow. You think that was fun or not? We moved to the current location of a three-story city building, which was acclaimed by some citizens as a Taj Mahal for our city. And we haven't figured out where the Taj Mahal came from, but the hall is still there. Well, thank you all for being here. It's very special, and you know, I'm delighted to have my county commissioner, Stacey Adams, here, and my constable, Buck Stevens, back there, and my great neighbor right down the street from me, and a police officer. That's nice when there's cars parked down there. It's quiet in my neighborhood. And of course, my two fine Councilmember Little and Councilmember Gary Moore, who are here supporting us. I think this is very special because it's an opportunity for citizens to help citizens. And the citizens we're helping are those in our area who are in need of medical help. And there are a number of us who are less affluent and less blessed with progress. So this is a great opportunity. And when Sam asked me to serve on this committee, I said, I'm great. Of course, this started originally, I don't think you told this, in the Menashe Temple. Dr. Nathan has started a clinic there. We had all of the hospitals, Southeast Memorial and all of the other local hospitals and the one in Pearland now. And it was amazing what kind of clinic we had down at the Menashe Temple. But we did not get an awful lot of the community. And in our discussion, I said, we need to reach out where it could be more locally centered, where it could serve a broader private population base. And of course, Dr. Nathan keeps his ears open, and he has made this thing something very special. And thank you so much for your contribution to those individuals who are in need of medical service and who cannot afford the ones that we all have come to accept as norm. So with that in place, I want to do something that mayors are prone to do, that is issue a proclamation. Now, in issuing a proclamation, I always say that this may be the mayor's proclamation, but it's also said the council members' proclamation. So, in keeping with that progress, I'd like to ask Councilmember Moore, Councilmember Little, come up and join me here. You need to know these guys a little better. It's kind of interesting. Monday night I'll be issuing a proclamation for safe motorcycle driving. And at the polls at the last election, at the final Saturday, and at the polls at the last election at the final Saturday night, and we were closing it all down, and Councilmember Little helped fold up the tents and load the stuff around and everything, and it looked like pretty clean. You know what he did? He jumped on his motorcycle and went home. And so the proclamation named it you as well. But let me present this on behalf of Office of the Mayor, City of Pearland, whereas the SEVA Clinic, derived as SEVA from Serve as a Clinic, has been formed as a Texas nonprofit organization to provide primary care for minor, non-life supporting and threatening illnesses, to serve needy Pearland citizens and those it has been designated as a 501c3 tax exempt status by the Internal Revenue Service, so we are legal. And whereas the SEVA clinic will provide free basic outpatient medical care for citizens who are insured or underinsured, and will accept donations and volunteer service from those who wish to further the work and progress of our clinic. And whereas the SEVA clinic was set up and opened with the support of many volunteers, including practicing doctors and nurses, and a number of those are here today from Southeast Mobile and Benedict hospitals, in addition to construction companies and community leaders. That's all of us here and many more. And whereas the SEVA clinic will be located in the building of the Pearland Neighborhood Center located at 2335 North Texas Avenue, and will provide a much-needed service to Pearland citizens in need of medical assistance. Now therefore, I, Tom Reed, by the power vested in me as the mayor of the city of Pearland, Texas, do hereby proclaim May the 20th, 2017 as SEVA Clinic Day with the support of my city council in Pearland, and I ask all citizens both near and far to join with me in commending Dr. Nathan, founder of the SEVA Clinic, and the board of directors and the local volunteers who are recognized and appreciated for providing a valuable medical service for citizens in need in our community. And it was a great deal of pleasure that I signed this on my hand and seal of office this 20th day of May 2017. And I'd like to present this to Dr. Nathan in respect and appreciation of his accomplishment of doing something I think is much needed, not only in our clinic, in our neighborhoods, but about our state and nation. And this is something I think you're setting a local, so we may be a model for other communities in the future. So let me present this to you, Dr. Nathan.
Terry, you want to come on? Joanne and
We do have board members here, so we'll get the board members to the board of directors.
Thank you.
I did want to tell you also that where the office now, the medical office, was the police office. Police department was in there, and at the back was the jail. And it was only about several years ago we took all the bars down. And the city attorney, the city manager, and the city secretary also roomed in this same building. Have we grown in Pearland, or have we not? You could tell the comparison of what we are today and what we were to your experience, what we were in 1985. So thank you very much.
So we missed Dr. Appan in the picture, but he's going to come and give us brief remarks.
Good morning. Congratulations, Dr. Nathan. In my 50 years of life in this country, I have had many name tags. This is one I'll be most proud of. To be in the team with Dr. Nathan working for SEVA Clinic. As an immigrant to this great nation, you know, we all work hard, work very hard to achieve success and to be a very productive citizen of this great nation. And we must give back to the community And there's no better way than being a part of SEVA clinic to help people who really need help. I really appreciate being a part of this clinic, Dr. Nathan. And I would like to warn all of you, Dr. Nathan has one disease which you probably don't know. He's incredibly passionate about community work. If you get close to him, you're drafted. The thing is, it's a joy to work with him. I have been privileged to work with him for 20 years, and thank you, Dr. Nathan. Congratulations.
You are on the dot. 1 minute, Dr. Thank you. We need to keep it moving. Jim, you are next. Jim Dixon.
I've known Dr. Nathan for many years, and I'm just very pleased that he's helped me, invited me to help him with his prayers.
Closer. Oh, that's it?
Closer, that's it.
Thank you, Jim. He's a man of very few words.
Dr. Evan, you're absolutely correct about being drafted. That's what happened to me in his office. And then he asked me to pay my bill. However, the idea inspired me simply because of how many of you professionals were getting on board. You can't help but get excited about something like that and be willing to participate when you see the enthusiasm of the doctors and nurses that are volunteering their time. And the hospital was willing to step up. And that's pretty good for someone like Memorial Hermann to do that. So being that I've used the facilities a few times to my betterment, I thought it would be the thing to do to be able to give back to those people that we employ at times that do not have anything and have no way of taking care of their children without going to the hospital to find out what's wrong with them. So I commend you, Dr. Nathan. You're full of surprises. And we hope to expand this in the future. Thank you.
Thank you. I would like to ask Memorial Hermann leaders, the Chief Executive Officer, Kyle Price. Kyle.
Good to see everybody. Good morning. I've known Dr. Nathan since 2005. I don't know if you know it's been that long. And about 19 months ago, maybe 2 years ago, Dr. Nathan made an appointment to meet with me. And usually Dr. Nathan just comes into my office. He doesn't make an appointment. He just walks in. So I knew this was something extremely important if he called my assistant and wanted to schedule time. So I was prepared. You know, anytime a cardiologist comes down, I was prepared for the worst. But he made an appointment to speak with me about this clinic and about his desire to open this clinic and his desire to serve the community. And that was a great meeting. And we were on board the minute he came and announced it. So we're excited. Just like the clinic nonprofit, Memorial Hermann's a nonprofit organization. We really believe in giving back to the community where we live and where we serve. So the team, Kelly and Mario, rallied around the idea. Mario spent hours working with our system to get the $10,000 released for the clinic. We couldn't be more proud of the work that you guys are going to do. Super excited to be part of it and support it, because we truly believe there's no greater calling of people but to serve other people. That's our greatest calling, and that's exactly what you're doing here. So congratulations, Dr. Nathan.
Next is Mario Gunn.
I'll say it all.
Kelly, what is this?
I'll keep it short. I want to echo what Kyle said about our privilege to support the work of this clinic. I live in this community literally probably within 5 miles. I've raised my children here. I go to church here. My kids have gone to school here. And I feel absolutely thankful and excited about the opportunity that this clinic represents to this community. There's lots of people in need, and there's no greater joy than to serve those around us in need. So I just wanted to come up and say congratulations, and on behalf of this community, thank you so much for your heart for service.
Doctors out there.
All of you.
The president of the Pearland Neighborhood Center. Brad Christian.
Well, I want to welcome you all to the Pearland Neighborhood Center this morning. We were founded in 1987 as a facility to provide a foundation of effective services and responsive programs to develop individuals and families. And I think that Dr. Nathan and the SEVA Clinic dovetails very nicely into what we do here. We got the food pantry, Santa's helpers, school vouchers, financial stability. We have a bunch of different social programs that we provide here. And now this medical clinic is going to, like I said, dovetail very nicely into that. Just want to thank everyone for showing up. And as the Pearland Neighborhood Center, we feel privileged and honored to be able to partner with them and Dr. Nathan. Thank you.
Thank you. Next, I request Carol Otts-Busick, who is the CEO and President of the Pearland Chamber of Commerce.
Thank you so much. Wow, isn't this wonderful today? They have kept saying we're starting small. Well, remember, it only takes a spark to get a fire going. I'm Carol Otts-Busick, CEO of the Pearland Chamber, and since 1963, we've been building business, leaders, and community. And we've been a partner with the Pearland Neighborhood Center and Christian Helping Hands since they started in this community. I think the Neighborhood Center was in the 80s, Christian Helping Hands, 1987. Christian Helping Hands was late 90s. 1984. So since then, we have worked as partners with them in our community. A healthy community is a successful community. So we thank you for your partnership along with these other organizations. Again, this is 2017, you're starting your spark. We wish you the best, and we pray for continued blessings upon this organization.
I met with you along with the mayor the first meeting. She was there. She's the one who directed to this PNC, by the way, if you want to give out a secret. Commissioner Adams, would you like to say a few words?
Politicians. Oh, no. You're going to give him a mic?
I really don't need it. No, I mean, what a blessing for our community to have you come here. And when we talk about all the professionals, doctors, nurses, specialists, it's not just your time away from your practice and your patients, it's time away from your family as well. And I know how that can be, and I just want to thank y'all for signing up, volunteering for this. It does mean a lot for our community. And I think it's a need that we've had for quite some time, and it took someone to bring it to fruition. So thank you for everything you've done, Doctor.
We are wrapping up on behalf of the physicians. Dr. Subhadra, would you say a few words? And then Joanne Barrett.
Thank you. I think you said thank for all the physician volunteers who immediately helped me to schedule it. And I welcome new physicians.
That's welcome for the new physician. Joanne Barrett. Thank you. There are several community leaders here. On behalf of all of them, I request Sam Kannappan, who is the honorary president of Sri Meenakshi Temple.
Dear friends, as you all see, this is a milestone day to serve the citizens of Pearland. And under the leadership of the mayor, the councilman, and the commissioner, I think we have a great start, Dr. Nathan. I have to call him Dr. Vadaganathan, full name. And we are pleased to be part of this great effort. Wish you the best, and it will grow to great heights. Thank you very much.
So anybody else wants to say a quick word? Ramesh, you want to say? Arun?
No, I just want to.
And Dr. Menon, if you want to say it. You can say from there.
I just want to thank Dr. Nathan for his efforts in service, and I have seen him over the years, and I completely agree that he has an infectious degree of enthusiasm in serving the community in various capacities, and we are so proud that we're part of this team. Thank you very much.
After Dr. Menon, we will conclude.
Good morning. Congratulations to Dr. Nathan and all the people who are involved in volunteering. You know, when we all get into the line of medical profession, whether it's a doctor, nurses, whatever, our primary objective, at least, if not all of us, most of us, is to serve the people. And SEVA is a server. To serve the people is our, and unless we do some charity work, we are never a complete medical professional. Congratulations to Dr. Nathan to initiate this and a much needed service to this community of Ireland, and contributing to what Mayor Reid has been doing for so many years. Ireland can be proud of one of the best, the most leading city in the country. Thank you all.
We'll be concluding with Secretary Srikanth giving the word of thanks, and then we will move to the front for the ribbon cut.
Thank you, Nathan. It's an honor, truly an honor and a privilege to serve on this board with great professionals, actually, part of this. He thanked everybody, and I'd like to thank Vadaganathan. So we all have a little bit in us, actually, what we want to give it back to the community, right? A lot of us have kids, busy schedule, busy work. There's a little bit of, we want to give it back to us. What Nathan does is pulls it out, brings it out, bring everybody together, and then make it a big organization like this. Again, congratulations for bringing everybody together. In terms of word of thanks, what Vadaganathan also does is when he takes the mic and he does everybody's work. So he thanked everybody already. So that made my job easier. So again, everybody, thank you for coming today. And I know it's a busy schedule for all of us, so we'll conclude with this, I guess. Thank you again.
Once again, thank you, and many of you came in after you have started. We'll personally meet all of you, and many physicians have came after I started, after my speech, so please thank you for coming. Family members and others have just showed up just to show support, and thank you again. Yes.
Can I add one thing? For all you folks that would like to, there's a donation bucket right at the door. It's actually got some money in it to show you how to put it in there. So if you would kindly walk by and bless that on the way out to the ribbon cutting. Thank you.
Awesome. I forgot to mention this one here. I think I'm sure Nathan already did it. I want to thank Jenna and Nitya and Naj for yesterday coming and setting up this. We have a microphone today because of Jenna, and we have this set up here because of all of them. So we thank you everybody for that.
So we're going to, please feel free to have some more breakfast, but we are going to walk, we take 2-3 minutes to just get everybody out, and then we're going to stand in the front, and we're going to take a picture and ribbon cutting all at the same time. Thank you again.